Today we're going to be having a question and answer session on NuvaRing, etonogestrel ethinyl estradiol vaginal ring. So why are each of you here today?
Well, I'm a very busy businesswoman, and I just don't have time to take the day-to-day pill when I get another form.
How about you?
Well, I have 4 kids, and I'm just not ready for another one yet, and I'm too busy between 4 kids to remember to take a pill.
How about you?
I'm just sick and tired of having acne all the time, and I have a really heavy flow that needs to be controlled.
Well, that's great. It sounds like the NuvaRing will be a great fit for each of you. So, who wants to start?
I'll start.
Okay.
How does the NuvaRing work? I always wondered about it.
The NuvaRing works by inhibiting ovulation by altering cervical mucosa and endometrium of the uterus. That leads to inhibiting the sperm from entering the uterus, which prevents pregnancy.
What do I use the NuvaRing for?
Well, as I just stated, you use it to prevent pregnancy and treat heavy menstrual bleeding.
Can you tell me if there's any side effects that I need to know about before I start taking this?
Yes, just like any drug, there are multiple side effects. Some of them include blood clots, stroke, heart attack, darkening of the skin, toxic shock syndrome, increased blood sugar, vaginal and or cervical irritation, headache, mood changes or depression, nausea and vomiting, weight gain, vaginal discomfort, and decreased sexual desire.
All right. What about if I'm taking any other medications? Is there any interactions with anything?
Yes, there are some interactions with other medications. Certain anti-seizure meds, such as barbiturates, medications to treat fungal infections, certain hepatitis C medications, meds that treat tuberculosis, medications that treat hypertension in the vessels in the lungs, and some chemotherapy-induced nausea and vomiting medications.
So, how do I use the NuvaRing?
Well, you use the NuvaRing exactly as your provider tells you to use it. It is used in a 4-week cycle, and you insert 1 NuvaRing into the vagina and keep it in place for 3 weeks. Then you remove the NuvaRing for a 1-week break, and during that 7 days, you will usually have your menstrual period. And it is important to note that you insert and remove the NuvaRing on the same day of the week and at the same time.
Okay. Is there anything else I need to know before taking the NuvaRing?
Yes. While using the NuvaRing, you should not use a vaginal diaphragm as your backup method of birth control, because NuvaRing may interfere with the correct placement of the diaphragm. And also, you should not leave the NuvaRing inside your vagina for more than 4 weeks. And if you do, you may not be protected from pregnancy, and you should see your healthcare provider. Also, your healthcare provider should examine you at least 1 time a year to see if you have any signs of any side effects from NuvaRing. And also, you should only use 1 NuvaRing at a time, because too much hormonal birth control medicine in your body can cause more of those unwanted side effects.
That's all it is?
Okay, great. Some more important things that you should know include NuvaRing does not protect against HIV or other sexually transmitted diseases. You should not use NuvaRing if you are over 35 and smoke cigarettes. Smoking increases your risks for serious heart and blood vessel problems. And also, before using NuvaRing, you should tell your provider if you have any medical conditions, if you smoke, if you are pregnant or plan on becoming pregnant, if you had recently had a baby or miscarriage, if you have a family history of breast cancer, if you have or had liver problems, if you have elevated cholesterol and triglycerides, if you are breastfeeding or plan to begin breastfeeding, and make sure that you tell your provider about all of the medications that you are currently taking. This also includes herbal supplements. And please call your provider immediately if you have any sudden leg pain that does not go away, shortness of breath, sudden blindness, severe chest pain, or a sudden severe headache that is unlike a usual headache.
Thank you for meeting with us. I learned so much information.
You are so welcome. I actually have some brochures for you to take home.
Thank you.
You're
Thank
welcome. And also, I do have some samples. Would anybody like a sample? NuvaRing? Okay, NuvaRing for you. And you get a NuvaRing. And you get a NuvaRing.